Hi, I'm Dr. Peter Coleman. I'm a retired physician and a board-certified addiction medicine specialist, and I have over 40 years of experience with my own personal recovery and treating patients with opioid addiction. Today we're going to be talking about whether alcohol and drug addiction is really all one disease. And a patient story will, I think, be helpful. It's a sad story. I got a call a few years back from a mother of a patient who we had treated. He'd come in from Albuquerque, and he came in and got detoxed with us, and we put him on long-acting naltrexone that blocked his opioid receptors and took away his cravings, and he did really well as long as that lasted. But he didn't go to any rehab as he promised he would, and he didn't do any support groups, and so he never learned about the fact that the disease is all one disease. And so he didn't buy into that idea, and he started drinking alcohol, and according to his mother, he started drinking a little bit more over time. And after about 8 months, he was on his way to go snowboarding on a Saturday morning, and on a Friday night, he went to a bar and had a few drinks and ended up going back to some guy's apartment in order to do some opioids, and he died of an overdose that day. So it was a very sad story, and just shows that it is one disease, and it doesn't go away just because you stop using opioids. It's not an easy concept to get. In fact, when I went to rehab myself, I was using too much cocaine and injecting opioids and had a drug overdose, and I knew after a month or so that I needed to stop doing those things. But then they said, well, you're also an alcoholic, so you need to stop drinking. And I just couldn't believe that that was true. It just didn't make any sense at all. But when I talked to people, I just saw over and over so many people who had tried giving up one drug but not giving up others, and always getting in trouble. They were back in rehab because they'd stopped opioids but kept drinking, and then they got in trouble again. And doctors didn't used to even think about this as being a separate disease. Back in the 60s, they used to give alcoholic patients Valium because they thought that would be a great substitute, and then they wouldn't drink. And it just ended up really badly. The people became addicted to the Valium, and then they usually started drinking alcohol and combining the two, and that was especially difficult. Now we know an awful lot about the brain and what actually happens and why it does make sense that this is all one disease. Because we know that the disease at its heart is all about the dopamine spike. So people get that dopamine spike, and we'll talk about that in other chapters, and they really love it and they start valuing it. And when you give up the dopamine spike from opioids, but you still get it from alcohol or from other drugs, your brain doesn't, in some ways, know the difference. So we also know that part of the disease process is that the drugs change the brain and injure it in ways where they affect the memory circuits, the emotion circuits, and those all get affected in very similar ways by other drugs as well. So again, once you stop using one drug but keep using another, the disease process is still continuing to go along. We also know from genetics that, people who inherit the genetic tendency from one drug often end up, their children have a different problem. We also know that genetics teaches that it's all one disease. Almost all of the patients that I saw with an opioid use disorder had either a parent or a grandparent who had alcohol use disorder problems, and so they'd inherited the same disease that was in their family, but it had showed up because they started using opioids and they got addicted to those drugs. So the bottom line is, things go much better when people accept that it is all one disease, and it's the way to get into complete freedom is to give up all the drugs and start learning how to live and have a happy life without those things.